Welcome to Men in Pause, the podcast that's changing the conversation about menopause by bringing men into it. I'm Mimi Fernandez, producer of the show, and we created Men in Pause because menopause affects relationships, not just individuals. And we like to say that where men listen and women lead. So for this first episode, we're sitting down with Melissa Walsh, OBGYN, to discuss care teams and communications, how patients can engage with practitioners. Melissa is a board-certified OBGYN physician executive with 15 plus years of experience delivering and redesigning healthcare in public, nonprofit, and tech-enabled settings. She has dedicated her career to addressing and advancing health equity in women's health, beginning in New York City's safety net hospitals, where she trained and served as a frontline physician and assistant clinical professor, and continuing today as a strategic leader shaping national models of hybrid AI-supported care delivery. Welcome, Melissa.
Thank you, Mimi, and appreciate being here for the inaugural show.
Awesome. So let's start out with talking about your experience from a physician and healthcare leader. What do you think are the biggest breakdowns in communication between women and their care teams during menopause?
I think this is a very important question and something that is a theme across the entire continuum of women's health, but especially in menopause. I think one of the biggest gaps I see is that we don't often capture the full impact of symptoms. Other than the presence of symptoms, we're not typically capturing the severity and how much they're disrupting daily life. From my experience in person and having to see folks in the 10 or 15-minute window, patients can often minimize their discomfort or frankly feel so rushed that they omit or forget to mention symptoms. And then at the same time, clinicians and practitioners may not be able to probe deep enough into how symptoms are affecting work, relationships, or mental health. I think the other breakdown in communication and just overall care delivery is that the follow-up and true monitoring of these symptoms are structured around these short episodic visits. So there's limited time to assess if we do get an intervention enacted, how it's really helping or not helping our patients along. I think this is where technology and digital health platforms can help improve these conversations and communication, not to replace that human connection that's so essential, but to refocus the conversation in that small time that we have so that it's about the shared decision making and not data gathering. I think another part is just the impacts of life stressors and life circumstances. That's not normally part of the conversations that we're able to have in such a short amount of time. And those really impact how women experience menopause, as well as their ability to respond or participate in the care recommendations that are made for them.
Thank you for that. David, do you want to add something?
When we take in the concept of men listen and women lead, and it's a pleasure to have Dr. Walsh on the show today, is really trying to understand what is our importance in this conversation between a woman and her practitioner, right? Whether it's a sister, a mother, a wife, or a close friend, how can we as fellas be supportive, empathetic, and caring, listening, and not always trying to fix things? So when we look at what's important between that communication, we shouldn't shy away from being there to listen and supportive when we're not going into the visit. Whereas there could be cases where you see these stories where the wife goes in to make sure the man's doing something. You generally will not see the man going in to make sure the wife does something. But what's really important to us to understand, not only about that communication flows, what happens before, during, and after, how it translates back to us, and how we can absorb that and be supportive in this, especially to menopause. So what is menopause? What does this mean in this conversation now? Like when you come home and say, oh, I'm in perimenopause, or I'm going through perimenopause, how am I supposed to respond to that to give that advocacy and support. What does that mean to me? And I think the communication between that practitioner and that patient extends back to us in the household.
Yes, definitely. I think there's a lot of communication that can happen between partners on what the woman is experiencing through the transition. I don't think that it's the role of the person experiencing the menopause transition to explain to their partner the pathophysiology of what's going on, but more this is what's been happening with me, and starting with that listening component is really a big part of the mental health support of going through the transition.
So, when preparing for these appointments, especially when tracking systems at home, for example, women might feel dismissed in a clinical setting. How can they be better prepared for these appointments so they do get the attention they deserve?
Yes, I think part of the dismissal comes from just the general discomfort of the healthcare ecosystem with the menopause transition. Obviously, we have menopause certified practitioners in growing numbers, and there is a lot more media conversation around the need to really pay attention to menopause and how it affects every aspect of life. I think that when it comes to preparing for the appointments, use the Future Navigate app to track symptoms, but also help to translate that data into your real life experience. So, not just saying, I have hot flashes, but how those hot flashes or whichever symptoms they're experiencing affect your focus at work or affecting your relationships or even your ability to sleep. I think framing symptoms around daily function makes it really hard for clinicians to overlook them and can gear the conversation more towards action. I think it's also important to be specific and be open about what they're experiencing. There are some things that, especially with sexual intimacy, pelvic discomfort, that have been stigmatized in the past, that we're starting to have more open conversations about, and preparing one or two questions around these not talked about topics, but if it's affecting your day-to-day life, preparing those questions specifically around that can either help your clinician to address it or at least be prompted to refer you to a specialist who can.
The framing is so important, being able to put the symptom itself into your daily life. And maybe your partner can help you, remind you of how it's impacting you.
So if, say, for example, if I understood diabetes or hypertension, it seems like, what do I do if my spouse or significant other says, I'm going through menopause? And some days she may appear or everything seems great, and other days it's not. Is this associated with what's going on? How do I respond to situations like this to be more supportive?
Yeah, I think that when you notice there's a change in demeanor, tone, or just engagement in a conversation or enthusiasm about an activity, just taking a pause to check in. Like, how are you doing today? Especially if you've already had the initial conversation of the statement, I am going through perimenopause, or my doctor said I've been through menopause and these symptoms are due to this. Having a check in related to things that have been expressed earlier, or just a general check in about how they're doing and how they can be supported. Sometimes it may be a frazzled moment, and the partner may not be able to express, this is exactly what I need, but creating that space and telling them, like, I'm not sure what to do for you right now, but I am here for you. I think that's very powerful in providing that comfort.
And it seems like if we can help, knowing if they're going to the clinician, to remind them, hey, remember on these occasions, these things happen, in case you didn't remember. Because I think the time between visits allows memory lapses to take place.
Oh, yes.
So the more support that we can provide in these scenarios could be beneficial. It's just for men not to dismiss what's going on or just not try to label a symptom and think it's something else, but understand this is a person experiencing something and be observant of what that experience is versus try to categorize it or label it as something and just see the human interaction in it.
Yes, and also acknowledging that sometimes there isn't a solution for that moment, but there is always an opportunity for support. I think goes a long way, especially if it's repeated over time, not just a one-time check-in, but just periodic to encourage that conversation. And then, if you're able to, if the partnership is so that you can come to a visit, I think that also helps to bolster support and understanding for both parties.
Just to set in context, as a man, we probably know less about menopause, but I also think that possibly what we understand about menopause is even less, is general. Is it more than just a loss of fertility? Because I'm hearing symptoms now, and it seems like I wouldn't be expecting symptoms. And what are some symptoms that I should expect somebody to be going through? Because whether it's in my house, maybe it's in my workplace, and just being more aware of what's going on and understanding menopause is more than what we thought it was.
Yeah, no, it's a great question and it's also a very careful question because you don't want to, like you alluded to before, put a label on something that somebody else is experiencing. But you want to be conscious and sensitive that we all age, we all changes in our body as we do age. And there are the few times that a partner has come with one of my patients to the visit to really understand like what is going on, why is she not as perky as before, what are these hot flashes, what can I do for them. Things that you might be seeing in the home unit would typically, folks are a little more expressive of having hot flashes, difficulty sleeping, night sweats, and irritability, just not feeling in the mood for intimacy or conversation or going to an event that they may have been looking forward to previously, and checking in about how they're feeling and if anything could be changed that you could help with to improve the situation at the time, whether there's hot flashes and I really like an ice cold glass of water, and just getting that for your partner can be a big help. The workplace may be a little more sensitive, but brain fog and memory lapses are getting growing recognition as a component of the menopause transition because of the effect of estrogen decreasing and how that affects our memories. So if we have a coworker that's used to be super sharp, elephant-like memory, and now things are slipping, maybe receiving each other with a little more grace and support around they forgot this one time, it's not a big deal, and supporting each other around those events.
I think that this sensitivity is really what's coming through here. So you've been involved in advancing health equity and AI-driven care pathways. How can AI pathways and innovations empower women to have a stronger voice in their care conversations and maybe also with their partners? Because we might not always articulate in a meaningful way what we're going through.
Yes, I think this is one of the areas I'm most excited about for women's health. Historically, women's health has been at the end of the list of innovations and new technologies. To see this surge now is very exciting because I think that these tools can give women or what I would consider like an organized autonomy. Of course, we always have patient autonomy, but in this technology-driven world, we need that organization to really empower us to express that I'm going through these symptoms objectively. This is the frequency, the intensity, the effect of them on my day-to-day functioning. I think that can translate into something that's both personally and clinically meaningful. Because if it's used in a way that can bring in personalized education and recommendations based on my own health history, my values and preferences, you can walk into your care team appointment with a clearer understanding of your options so that you have a better confidence around what you're experiencing, but still deferring to guidance with your care team because they're the health experts, but you're the expert of your own experience. I think that the AI-driven care pathways especially will help patients to be able to co-create their care plans with their in-person teams in a way that we haven't been able to before, just because of that shortness of the visits and the more traditional focus on data gathering versus what we would really truly like to be doing is the shared decision making. I think in terms of advancing health equity, I think that if we're careful about how we develop our platforms, they can help to reduce bias and making sure that women from all backgrounds receive evidence-based information, not just those who have easy access to specialists. I think that can help in a lot of ways because depending on the culture, depending on the family dynamics, you may or may not seek certain services, but if it's health education that's more broadly available, I think it helps to address equity head on and also facilitate those conversations within the home.
I think of in hearing this, two things. It's the saying is you can't manage what you don't monitor. And outside of the clinic, we have to take ownership of our health and not be relying on episodic visits. So
Mhm.
having this and
Mhm.
in many cases, and from information that I know, women on more unique medicines, multiple medicines, but they're also more in tune to their bodies. So the medical devices, the applications are good Christmas gifts. It sounds like good caring gifts to help bring more health intelligence into the home as well.
If you could redesign the menopause conversation, we touched on this, but how you would redesign a 15-minute clinical visit, what would it sound and look like to you? And how could you incorporate all the monitoring into those visits?
Yes, in the future, I will try to manifest this for our future selves that initial visit where a patient is connecting with maybe the OBGYN they've been seeing for years or seeing a new clinician, if they were able to have this symptom experience tracker summary already from the past few weeks, the past few months of symptoms that highlights what's most bothersome, what's changed over a certain amount of time that they've been tracking, and what barriers or life experiences have happened that coincide with these symptoms and experiences. I think if you have that already set, the ideal scenario would be the clinician's able to see it before the visit or review it at the time of the beginning of the visit as you're checking in so that when you walk into the room, I could just start the visit with, I see you've been struggling with, let's say, sleep and hot flashes. So we can start there on those symptoms and dig into how is it affecting your day? What have you tried? What's worked so far? What hasn't? And then it becomes less about checking the boxes of the intake and more about problem solving and what is the action that we're going to take from this visit? And then what are we going to look for at the follow up visit? And then with the follow up visit, which will probably be another 10-15 minute visit, you could look at the progress of what the intervention was for those symptoms and experiences and assess with the patient. Does this feel like good progress to you? Is this something you want to try a little longer? Or are we going to throw this out and try something different, as well as explore like what has made it maybe challenging to adhere with this treatment? Because sometimes it's not they didn't want to try something, it's they couldn't get to the pharmacy was out of stock, or there were financial barriers, or they couldn't get to the pelvic floor PT. So it's all well and good to recommend things, but if you can't actually execute on them, then are we really taking care of you? And I think that should really be the focus of the visit, not how are you feeling? Okay. And then 5 minutes of counseling, and then that's it. So I'm hoping that would be our future life of clinical visits.
I love that you said, let's manifest it. Let's make it happen. I love that. David, anything to add?
I think we're regulated to a short amount of time in a very busy and structured day, both for the clinician and for the person. I think to follow on is like, what would you want to see after the visit? Because the visit's such highly concentrated. What are those steps that you would want to see for the person to do? How would you like to see that person carry those steps out? Because when is the next visit? 6 months? Or it's a ways off. So that continuous monitoring, like how would you coach them? What do you want to hear from them so they don't feel dismissed or feel like 15 minutes is a blink in a month? And here, like my partner could be going through multiple symptoms, or those symptoms could be changing all the time. So it's like, when do I come back? Or how do I manage this? How long is this going to last or take? Whereas some things seem boxed in, or some things seem more chronic, where it's just going to be like that, and I have a new normal. For me, it's really understanding is the time between the visits, right? How do you prepare them? How do you prepare them in the 15 minutes to what the next thousands of minutes are going to be like?
Yeah, no, it's a very important point because I think, again, I am a little repetitive, but I think that is the huge opportunity for technology and digital health platforms, telehealth practices, is those moments between the in-person visits where we can set goals with our patients as part of that shared decision making. So if you're starting a medication for, I'm just focusing on hot flashes for the example, but within 2 to 4 weeks, we want to see your severity score of 8 go down to at least a 6 for the hot flash symptom. But let's say it responds very well to that, but now you have a different symptom manifesting and your sleep is irregular. And also there's been unfortunate loss in the family. And how do we expect your symptoms to respond to that? I think that making sure there are ways of communication to the care team when things change, whether it's through my chart or a virtual visit, would be ideal. And then the other component to care is your community, your network, your family, your support persons, that they can also do the check-ins with you and help you to advocate for yourself when things, maybe the next visit. When I was caring for menopause patients, starting them on a new medication, like, we should check in within a month to see how things are working for you. Unfortunately, not every practice is like that. Some folks don't have a follow-up until 3 or 6 months later, and well, your whole life could have changed within that amount of time. Keeping your partner in the loop about what you're experiencing, what you're trying, so that they can help you to reach out that this isn't working for me and that or other symptoms have changed, can help you to get back to care to address the next steps more proactively.
So what I'm hearing and understanding as well, based off something you mentioned in there, is that there's outside factors of what I control, say biologically, that could be introducing what was a stressor, right? A symptom that's also a symptom of menopause that could be driven by an outside factor, that so it may not be related to menopause. It could be related to menopause, but a medication itself could also drive that same type of indication as well. So it seems, I want to use the word cloudy, but it seems very dispersed off where the symptom could be coming from, that we have to have better understanding and care and compassion that, hey, there's something going on. Let's look at what's happening in the person versus the various ways it could be originating.
Encouraging that dialogue between a woman and her partner so that they can support, whether it's the adherence piece or getting to the appointments that they need to get to, because sometimes you just feel like there's just so many things on our list. We need somebody else to be that encourager. Thank you so much, Dr. Walsh and David, and thank you for listening. And if you're a man who wants a better understanding and to support the women in your life, or if you're a woman who wishes the men around you got it, please subscribe for more episodes, because we believe that when it comes to menopause, nobody should be going through it alone. Thank you.
Thanks,
Thank you.
everyone.